So to begin, I would just like to acknowledge that the Women's Health Research Institute are uninvited guests on the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and is a provincial research institute committed to improving the health outcomes of women, including those across the 2SL GBTQIA+ spectrum. We recognize our responsibility in the collective efforts towards establishing culturally safe healthcare systems and services that address health inequities among Indigenous peoples, especially Indigenous women, girls, and Two-Spirit peoples. And as we gather together today, I just encourage you to reflect on your own positionality on these lands and your personal commitments to reconciliation. And as I look outside today and I see the sun and I can see cherry blossoms and other flowers beginning to pop up this spring, it just really reminds me of how grateful I am to live and work on these lands amongst the mountains and the waters. And it really causes me to pause and give thanks to the original caretakers of these lands for their amazing stewardship that continues to this day. And with that, I'm very pleased to introduce our round speakers for today. So Dr. Sandesh Shivananda is a neonatologist, health informatician, and quality lead at the University of British Columbia. His focus is on identifying gaps in care delivery and implementing solutions in real-world settings to improve outcomes. He has researched and published on innovative care delivery models, clinical decision support products at the point of care, and implementing care bundles and health technology integration in various neonatal settings. He brings the knowledge and experience from the fields of neonatology, informatics, improvement science, organizational leadership, innovation, and team behavior to facilitate excellence in care delivery, practice adaptation, and implementation. Jeneesha Dhaliwal is a research project assistant at the WHRI and has been supporting the vision study for over 2 years. She has a background in psychology and is currently pursuing her Master's of Arts degree in Interactive Arts and Technology at SFU. And for her thesis work, Jeneesha plans to explore the field of human-centered AI, specifically on trust and transparency in AI use. And Julia Zhu is a second-year medical student at the University of British Columbia with an undergraduate degree in health sciences from McMaster University. She has a particular interest in pediatrics and is passionate about quality improvement in healthcare, especially initiatives that enhance patient experience and outcomes. Julia has had past experiences working on qualitative research and has been involved with the Vision study since last April. So with that, I would love to turn over the floor to our presenters.
Thank you, Catherine, for such a nice introduction. And I'm really glad to have the opportunity as a group to come and do the presentation in this research rounds. If somebody is wondering what VISION stands for, it is a vital sign integration system to improve outcomes in neonates. This was part of a Digital Health Accelerator grant, which we got in 2022. And what we are presenting today is a subcomponent of this bigger vision study, mainly focusing on communication preferences among NICU caregivers, that is parents and families. Next slide. So our main objectives today are to present insights from our qualitative study, which mainly allowed us to gather some insight into what families prefer in terms of communication in NICU. And it also allowed us to learn about caregivers need a lot of support in NICU, and providers, like as healthcare providers, we can reduce them being overwhelmed through our approach. Next slide. So for those who have not had a chance to visit our NICU, we have one of the most technologically advanced and state-of-the-art NICU. We are really glad that we have that single family room, family-centered approach in our NICU. It's a quaternary NICU. That means the sickest and tiniest of the babies from British Columbia and the province of Yukon get admitted. About 650 admissions per year occur. And most importantly, more than 350 multidisciplinary healthcare providers look after babies. And babies can stay for a few days to a few weeks or sometimes months. And this on the right hand bottom corner, you can see a single family room where each room has a window, and families tend to stay inside and they have a sofa cum bed they can lie down and take rest. And most importantly, when so many people are working, effective communication is key for high quality care in an ICU. Next slide. This is a slide which shows the corridor in NICU. And in NICU, we have like 5 such big pods. And each pods on the right side, if you see the door, glass doors, they open into a single family room. Because all of us doing the rounds cannot go inside, most of the time we end up doing the rounds outside, but still making sure that the communication is good. And on the right side, the second person whom you're seeing is a mom who was very well vested, and then she was there at all the time. And again, who would be inside most of the time looking after her kid, but during the rounds would come out and then ask questions and then be part of our care planning. Next. So in NICU, because babies cannot speak and then they don't give us time when they are deteriorating, we rely heavily on vital sign monitoring. On the right side, you can see a nurse seeing all the heart rate, respiratory rate, oxygen levels, etc. on a bedside monitor. On the left side, sorry for the poor quality, the nurses have a station where actually they can monitor 6 to 12 babies, all babies in NICUs, their heart rate, and if any alarm goes off, they can go and respond to the needs of the kids. Next slide. But if you were to ask any healthcare provider or any person coming into NICU, what do you recognize immediately? Here are the few things which come up. There are always complex and unstable infants. There is a lot of technology. There's information overload. We get flooded in it. And data integration is very key for making decisions, especially when large teams and a lot of handover and turnover happens. And of course, when you have so much of machines, each one of them will keep dinging and then there'll be a lot of alarms and we have to respond to them. Next slide. So previously, when the bedside monitors were devised, the goal was, okay, you set an alarm limit. If heart rate goes below or high, it will beep or provide an yellow or red color alarm. You go inside and then rescue the infant. That was the idea. But nowadays, the monitor can do much more than that. Actually, they can summarize the data for 24 hours. It's almost like hemoglobin A1C. You get a summarized blood sugar of how 120 days of sugar level control has been. Similarly, by doing a daily summary, you can get an idea about how the oxygenation status is, how the respiratory status is, how the heart rate or cardiac status is for the baby. And then tracking them may allow you to see whether babies are improving or deteriorating, whether you need to escalate or de-escalate care. Next slide, please. But of course, there are a lot of communication related issues. Infants' wellness fluctuate a lot in NICU, sometimes minute to minute, sometimes days. We have to be always be vigilant. But communication of the infant wellness to the family, unfortunately, is episodic, and it's always provider dependent, and it also depends what else is happening in NICU. Parents experience gaps in understanding their infant's wellness between formal clinical updates. And if there are poor communication, it always leads to over extrapolation, parental stress, isolation, low trust and rapport, and low confidence and engagement with healthcare provider team. Next slide. In this sort of situation, we had a challenge in our NICU that continuous physiological data from monitors are there, but they still display as numbers. They don't say your baby is stable today or unstable or in a watcher status, so we are carefully watching, etc. So we took that challenge and asked a question, can you automatically report daily infant wellness state and its change from previous shift or day by summarizing physiological data? That was the main grand purpose. Next. And then we partnered with the technology company and who provided the Neo device, which are there on the right-hand top corner, which can collect data from bedside monitor, ventilator, and other devices. And they can summarize based on the algorithm or the clinical rules which we provided. So we had developed a clinical rule, say baby spent this much amount of oxygen in this much period, then baby could be termed as stable or watcher or unstable and similar such rules And then we wanted to trial it out in 7 beds in NICU, whether the technology can perform the way we want the infant wellness reports to be reported. Next slide. These are some of the slides on the top. As you can see, the data flows from the NEO aggregator device into a server, and then it can provide the report in tabular form, or graphical format, or in averages, whichever way we want. Next slide. So the simple answer to that question was yes, the technology allows us to do all these things, and it can provide a daily infant wellness report. The preliminary information from parents and also from bed care providers is that yes, this technology would be very helpful. Next slide. And then we also did some kind of validation when machine automatically reported infant wellness, and when we compared with manual categorization by nurses, we found that the correlation was about 49%, roughly half and half. But what we quickly learned is if we provide more information, and then if we tweak the algorithm or clinical rules, actually the prediction can be much more better, and automated wellness reporting could be very helpful. Next slide. Now, changing the focus to a little bit to about parent information seeking behavior. The slide on the right side speaks for itself. Parents are sitting there all the time. They probably look at the monitors much more than any healthcare providers, and they prefer accessing information which is readily available, which is personalized and accessible, even outside the formal encounters. They believe that, okay, if they keep watching and everything is normal and there is no alarms, it would reduce uncertainty. They have some control on the environment. And if they find that there's something different from yesterday, that would be a guide for them to ask questions and bring up during the rounds. So which essentially many of the studies have also shown the need for continuous situational awareness is not just the healthcare providers want it, but parents also in single family room would appreciate having that kind of information. Next. So while we were working on this, my colleagues at McGill University were working on a smart home or NICU program, and they wanted to get rid of all the wires and other things in NICU. They wanted to build a wireless system in their NICU so that no baby is on a leash of wires. And next slide, please. And in one of their efforts, they also wanted to design a bedside monitor which doesn't look like only technology and numbers, but it's helpful for parents. Say, for example, this screen is good for to be outside when healthcare providers are using it. Next slide. And they provided as a template, which they thought it's a simplified parent view. It will tell in emojis or some other form so that parents quickly come to know how their baby is doing when they come inside the single family room. Next slide. So, as you can see from my introduction, technology makes it feasible to provide infant wellness data for parents inside the single family room. You can, based on family's needs, you can make it very simple or keep it as it is, or you can summarize the data. Maybe it's not a difficult thing. You go inside, like how you deal with AI these days. Hey Siri, can you tell me about my baby? How has he been doing in last 4 hours, 8 hours? Probably it can voice out as well, if our privacy and confidentiality and others allow to do that. But that's not the main thing. But technology can do a lot of things. What do parents want when they're in single family room, when technology can do a lot of things? That's the question which we wanted to pursue in this qualitative study. So now I'll pass it on to Jeneesha.
Thank you, Sandesh. So this led us to ask, what if the INICU had a family-centered dashboard in each of the NICU rooms that displayed digital infant wellness updates to families? So if we were to design this, we wondered if using parent-preferred terminology to describe 1, infant wellness, and 2, wellness categories, would this optimize clinician-to-family communication? So we had 3 qualitative study objectives, the first being to determine families' preferred terminology and wellness categories. So if there are certain terms or communication styles that the dashboard could incorporate to make families feel more informed. Number 2, to assess the usefulness of emojis in communicating wellness. And number 3, to assess if families were even interested in having this digital dashboard for them to refer to. So in order to inform our objectives, we conducted semi-structured interviews. So we included alumni NICU families whose babies have spent time in the BC Women's Hospital NICU since 2018. And so as all study materials were developed in English, we only included families who spoke English. And recruitment was facilitated by the NICU Family Engagement Advisor. And I believe Tom is on the call today, so thank you so much for that, Tom. And in terms of data analysis, we did use interpretive description, which is a qualitative approach that examines patterns in experiential data to generate clinically relevant insights. So a little bit more about our semi-structured interviews. So we did initially develop a interview guide. And so we piloted this with the NICU Family Engagement Advisor, as well as an Indigenous NICU representative to receive feedback on clarity, flow, and the use of trauma-informed language. And so interviews were scheduled to be 60 minutes long and over Zoom. And we did record the interviews so that they could later be transcribed. So in terms of the interviews, each family did attend one interview. However, the interviews were structured to have 2 different components to them. So the first was to encourage families to share their unique NICU experience. So this included asking questions such as what brought them to the NICU, what made them feel most and least supported, and what forms of communication were most and least appreciated. So this was done to help families kind of enter a similar frame of mind as they were in when they were in the NICU. And then for the later half of the interviews, we then introduced the iNICU device and spoke about wellness updates. So more specifically, we introduced the iNICU device as well as just the concept of having this potential digital dashboard for them to refer to. And then we also asked them about their preferred ways of receiving clinical updates, how they felt about using emojis to communicate digital wellness updates. And then we were also curious to see if they had any additional features in mind that we could also incorporate into the dashboard that they felt may make future families stay a little easier in the NICU. So as we were assessing how families felt about using emojis to communicate digital wellness, we showed families images of emojis as well as emoji scales to receive feedback on whether they would be useful in aiding them in understanding infant wellness. So as you can see here, there are 3 different emojis on the slide. These were shown individually to each participant during the interviews. And so along with asking families if this would be a useful way of communicating infant wellness, we also asked them questions such as, how would you interpret the following emoji and how would it make you feel? And then alongside showing just single individual emojis, we also showed participants blank emoji scales. So in this case, the digital dashboard could show as like an indication on the scale where infant status was for that particular day. And so when showing families blank emoji scales and asking them whether this would be a useful aid, we also asked them, would you rather see the emojis in a full scale or would you prefer only seeing one? And of these 2 scales, as there's 3 emojis on one side and a larger scale with 5 emojis on the other, of these 2 scales, which do they prefer and why? And then we also included images of different emoji scales combined with commonly used wellness categories to see if families found these useful when receiving digital infant wellness updates from this dashboard. So in terms of participants, we interviewed 11 alumni NICU families. 1 family withdrew, and therefore analysis was conducted on 10 interviews. All families had 1 or more babies in the BC Women's NICU since 2018. So more specifically, 6 families had singletons, while 4 families had twins, where both twin 1 and twin 2 were admitted to the NICU. And so interviews ranged from 33 to 101 minutes long, depending on the length of the participants' responses. So in terms of analysis, transcripts were originally transcribed using Otter AI, and then we checked through the transcripts 2 times just to ensure for data accuracy. And then transcripts were then imported into NVivo for inductive coding. So inductive coding is the process of developing themes and categories directly from the data itself, rather than starting with any pre-existing theories or assumptions. And then data was analyzed using interpretive description, which incorporates thematic analysis to generate clinically relevant interpretations, which in this case would be to inform the future design of this digital dashboard. So using interview data to return back to the objectives here. So number one, families did not have specific terms or wellness categories that they preferred over another. Instead, they emphasized the use of plain language when delivering updates. Number two, in terms of the emojis, families did not find emojis useful in communicating infant wellness updates through the digital dashboard. They felt that the emojis oversimplified their infant's condition. And number three, while families were interested in the concept of having this digital dashboard to receive infant wellness updates through, they emphasized that they did not want this to replace any in-person communication. And now I will pass it over to Julia, who's going to go through the results in more detail.
Thank you, Jeneesha. So overarching considerations from these transcripts that we noticed for the INICU was one, tending to caregivers, two, making communication accessible, and three, facilitating and not necessarily replacing interpersonal communication. On to the next slide, please. So 4 themes that were derived from the qualitative transcripts that were found as common themes amongst participants included, number one, enhancing the accessibility of information in the NICU. Number two, promoting caregiver involvement in care processes. Number three, supporting orientation to the NICU environment. And finally, number four, fostering connections with fellow caregivers and peers and also family members. So moving on to the next slide here, we have a graphic that visualizes the 4 themes that I just went over. So in the 4 purple petals, we have the 4 themes, and all 4 of these themes contribute to the middle green section, which is the ultimate goal of what we want the INICU to do, which is to enhance caregiver and healthcare provider communication, making those opportunities for communication more accessible. We hope that these 4 themes would support hopefulness, instill confidence, and ultimately tend to caregivers. So moving on to the next slide. The first theme we mentioned was enhancing the accessibility of information in the NICU. So a lot of the participants reflected on how initially entering the NICU, they had very immense learning curves that they experienced, that trying to understand clinical details related to their infant's conditions and their ongoing treatments left them feeling really overloaded with information. And they particularly noted that it was difficult to retain the information that they received. So they wanted to receive updates in simple and easy to understand language. Many participants also emphasized that receiving this information in that sort of language helped to contextualize the severity of their infant's condition. It helped to clarify expectations, which was really significant in minimizing feelings of anxiety. And having that contextualizing information also helped to set expectations on their infant's health trajectory and also the care plan for their infant. And finally, when considering the potential use of emojis to convey the status of their infant's wellness, all participants really expressed that the emojis felt oversimplified and wouldn't offer that reassurance that they really need. They highlighted that emojis lack really essential contextual information, so they really don't indicate how current the update is, don't provide any clarity on when or how healthcare providers would follow up to explain what the emoji actually meant. So rather than easing that uncertainty that they felt, participants felt that relying on emojis would heighten their feelings of overwhelm and potentially undermine their confidence in the care of their infant. And they also felt concerned that having just an emoji update might replace direct communication from healthcare providers. So for the next slide, we have the theme promoting caregiver involvement in care processes. So another common reflection that participants shared was that being directly involved in their infant's care gave them a greater sense of purpose, and helped to instill hopefulness because they were directly involved. That said, many caregivers describe feeling very cautious, due to perceiving their infants as very fragile and being uncertain on what they personally could safely do in their infant's care. So they expressed wanting healthcare providers to explicitly invite them to participate in their infant's care and to also reassure them that interacting with their infant was safe and appropriate when those opportunities arose. So, what they imagined the INICU could do was to support caregiver involvement in three different ways. First, by informing families about what care activities they could engage in. So, for example, number two, allowing families to track care activities, for example, recording the number of feeds they assisted with. And finally, by alerting healthcare providers of when a caregiver would be ready to participate in care, the preferences in that, and also their needs regarding participating in their infant's care. So overall, participants felt that the INICU could help caregivers feel more integrated into the care team, and this would help reduce uncertainty about their ability to help. For the next slide, supporting orientation to the NICU environment. So many caregivers described that transition to the NICU as very abrupt and overwhelming, particularly because many of them felt they had not received enough preparatory information before entering the NICU. And without that clear guidance about what to expect, families often entered the NICU with a lot of uncertainty about how the physical space functioned and also what their role would be in their infant's care. So they emphasized that feeling acquainted and having a greater familiarity with the NICU environment could alleviate some of that overwhelm, such as having a better understanding of the physical layout of the unit. And when reflecting on the iNICU and how that platform could help, there were two different ways. So the first one they suggested was that it could provide an introduction to the physical space, the atmosphere of the unit, and the broader culture of care. So, for example, the platform could help offer anticipatory guidance through virtual tours, explanations of common equipment that they might see and use, and descriptions of daily routines that could help caregivers know what to expect daily. And then secondly, they felt that the iNICU could help outline norms of conduct and highlight opportunities to connect with healthcare providers. So for example, they could introduce members of the care team, norms of conduct, explain how and when families typically might be able to engage with clinicians. And this could potentially also help caregivers feel more prepared to participate in their infant's care directly. And so finally, another very commonly shared sentiment was that families felt that connecting with other families in the NICU made them feel more supported, particularly when it was with other caregivers who have been in the NICU themselves with their infants. And they also emphasized the value of the family advisor role, stating that the advisor was also someone who had gone through the NICU and could share thoughts that would enhance their understanding of the NICU and help navigate the whole experience. So, in terms of envisioning how the iNICU could be used as a platform to help streamline these connections, um, they felt that the iNICU could help support peer-to-peer connections with other caregivers in the NICU, by making caregivers aware of opportunities to meet, share experiences, and support one another. And helping facilitate these connections was seen by caregivers to provide additional emotional support, foster a sense of shared understanding, community within the NICU, and just overall help give them more confidence and reassurance in the overall experience. So bringing this back to the theme visualization graphic, we see again the four themes that we just discussed in the purple leaves. So making information accessible, involving caregivers, orientation to the NICU, as well as supporting connections with peers, and how all four of these themes would help contribute to more communication between caregivers and healthcare providers, making communication about the NICU overall and also their infant's care more accessible to the caregivers, and how this would also support hopefulness, instill confidence in the caregivers regarding their infant as well. So finally, the next steps. is to prepare a manuscript, which is currently in progress, and also to participate in knowledge translation initiatives, such as this presentation.
And we wanted to just bring this back to the dashboard that Sandesh had initially shown earlier in the presentation to kind of think about ways that we could improve this based on the information and the themes that emerged within our interviews. So as you can see here, it is a simplified parent view. Highlighted in the yellow box are certain vital signs data, such as body temperature, heart rate, and then SpO2, which is oxygen levels. So the first step that we could do to improve this dashboard is remove the emojis. And during the interviews, parents had indicated that they appreciate seeing vital signs data as well as lab data. However, they're not always sure what they are looking at. They're not sure what the numbers mean. They don't have information to really orient them to these reports, to these signs, as well as how this reflects on their baby's health. So what we could do instead is have the ability for parents to tap into these different components to see more information on, for example, their heart rate data, and have indicators on the sides of the screen that let them know that above this threshold or below this threshold, this is what it means for baby's health, as well as maybe some parameters for parents to refer to when looking at their data to see if they're meeting the vital signs data that they should be. Above the vital signs data, you'll see that there are feeds, diaper, and skin-to-skin windows. So based off of our interviews, families do appreciate the ability to engage in their infant's care. So by having these windows be something that parents can also input data into, rather than just being a screen that nurses update on the back end and parents just look at. So giving them the ability to tap into these windows and update the feeds or the diaper changes or the time that they've done skin to skin for themselves would be empowering and a way for them to also track the care that they have engaged in. So those are just two ways that we can think of improving this dashboard here, just based off of our interview data that we have collected. And we just wanted to say a special thank you to our qualitative team, all of our collaborators, and our volunteers who supported this project. And I'm just going to pass it over to Sandesh.
Thank you, Jeneesha. Thank you, Julia. So just to acknowledge, so we take this opportunity to acknowledge all the parents who participated in the studies, and we are always indebted to the infants and our NICU, which makes us possible to do the research and learn simultaneously. And a special thanks to Tom, who's our family advisor, who made all the interviews possible by establishing connections and also reviewed all the interview guides before we could take it to our parents. So in summary, so how does it all connect? This slide tries to explain. This is a conceptual model illustrating how a family-centered NICU dashboard influences parents' experience or caregiver experience. So as you can see on iNICU, which is any other technology platform, using plain language and context, asynchronous access, a lot of interactive features, orientation support, peer support linkage, would lead to better communication when combined with communication processes on the right-hand top corner, would improve caregiver experience. So that would probably reduce their feeling overwhelmed in an ICU, sense making, feeling supported. Ultimately, it all boils down to improving caregiver outcomes, building trust and rapport, and having confidence, and removing uncertainty during NICU care. And that eventually would improve caregiver experience and outcomes. Next slide. So thanks again for participating in this research rounds. We have plenty of time to take as many questions as possible. So now we will open up for questions and discussion.
Thank you. That was an amazing presentation. And I see we have a few questions in the chat. Sabina asked a question about the emojis, but I think that may have been before when you presented your actual qualitative data. So I'll just let her, if she wants to re-ask that question, if it's still relevant. But maybe in the meantime, Julia asked, do you have any information about the demographic SES or ages of the study participants?
The demographic, SES, and ages of the participants, we didn't collect the demographics in those specific variables. We have information on whether they were singletons or twins, as well as approximation of how long they've been in the NICU, which was from a couple weeks to a couple of months. But no, we did not collect the ages or the SES of the families, as that wasn't the focus of our interviews.
So I can just add into what Jeneesha has said. Probably the question must be coming in with all the technology, right? There is a big talk about digital literacy and digital divide from those who are probably coming from higher socioeconomic status, who are technology savvy, or younger age parents may be technology savvy, whereas those who are more experienced or slightly traditional or lower socioeconomic status may not be as savvy and then would not. So because of the small study population, we will not be able to interpret anything related to demographics, socioeconomic status, or ages from our study.
Great. And Sabina, I see you have your hand raised, so please go ahead.
Yeah, so I actually wrote it before, like about emojis before. Like as a parent of 3 kids, like I never been in NICU, but I was in a very like stressful situation. So I think like seeing all the numbers and beeping it can be overwhelming. But as I put in the chat, like smoothing the lines, like lowest regression or kernel density, like just to show to parents the trend and alert them like on the exceeding values, like when it's more dangerous or something like this. So will be like kind of the compromise before, because compromise between showing like all the data that it's maybe too much and simplify to emoji, because I think like parents are pretty intelligent people, and especially now when you have phone and artificial intelligence and you can Google and access all the information you need. I think like, in my opinion, putting emoji is kind of degrading the intellectual abilities of parents to understand information related to their children. So this is what's my opinion about it. Just wanted to add. Thanks.
Yeah, oh, sorry.
Go ahead, Julia, please.
Yeah, I just wanted to say, like it makes a lot of sense what you're saying, and it definitely aligns with what the participants were expressing as well. So, for example, like we mentioned, the participants do feel like they're very overwhelmed coming into the NICU. They sometimes feel overloaded with information and details. So they want something more simplified, but on the other hand, receiving brief updates that are just the emojis, for example, they felt like their baby's health was more complex than just like an emoji. And they lack that contextual information on, for example, what does this emoji actually mean? What does it mean in terms of the baby's health? When was this emoji updated? Things like that. So it's definitely exactly what you're describing. So we need to find that balance between something very complicated that the participant might not be able, or the family in the NICU might not be able to absorb, versus something very simplified like an emoji. And one thing, for example, that some parents expressed that they did like to receive was a wellness update, which is kind of a very brief update on the infant's health that could be put on the iNICU platform, that is meant to be something that will be expanded upon later by a healthcare provider. And for example, a family might be able to express, right now, I'm not feeling ready to learn about more information about this wellness update. This is when I would be ready to learn more about it. But that wellness update would be there to have like a brief update on what the infant's health is looking like.
And just going off of what Julia had just said, so as Julia mentioned, a lot of families felt that emojis were very oversimplified. Instead, they were continuously emphasizing that having as much information as possible and having that data is very empowering and useful for them. However, they wanted it presented in a way that uses simplified, plain language so that they can be contextualized and oriented to their infant's wellness status. So a lot of the times when emojis were mentioned, instead of agreeing to the use of emojis or finding them helpful, they tended to go more towards the use of plain language and making information accessible in that way.
Great, thank you so much. And Travis also has a question. He said it was a very interesting presentation, and he was wondering if NICU staff were interviewed about this dashboard and if they had any feedback on what it should contain, or if not, are you planning to have future engagement with staff? Is that planned?
I can start and I'll ask Jeneesha to add in. So in this qualitative study component, we didn't interview the staff. We didn't ask for their preferences about the simplified dashboard and what would be their preferences, what its impact would be on their workflow, workload, or what their thoughts on. Just as a corollary, like as a part of bigger vision study, when we were trying to generate some reports from automated machine reports and asking nurses reports, nurses obviously were asking a lot of questions. Okay, why are you doing this project, etc. So from that interaction, it looks like nurses at the bedside really prefer to have some kind of a summary report from all the bedside monitors every day. And now that would standardize the handover from one shift to another shift about patient wellness. And then if there is a technology which can summarize it and provide trends over last 7 days or a moving trend over every last few days, they said that that would be beneficial. But again, related to this parent simplified dashboard, we didn't ask parents as part of this study.
I'll jump in here as well, Sandesh. So just to kind of reiterate what Sandesh said and to add some more information to that. So with the iNICU device, there were two dashboards. So the initial one was just for care providers. So creating these infant wellness updates that only clinicians and care providers would see. So with that dashboard, which was a previous study that this one, the current one, built off of. So that previous dashboard, nurses did provide some information and as well as some care providers in terms of like what they would be looking for and what they would find helpful. However, with the family-centered dashboard, which is the one that we're looking at the moment, we have only interviewed families. However, I do think it would be useful, Travis, if we did interview care providers as well as nurses. Families did indicate that the people that they were most in contact with were nurses, the bedside nurses. So in the NICU, the nurses, there's usually one that's assigned to each infant or assigned to two infants. And so they have contact with the family the most. It could be that nurses may also know of additional features or different things that we can add to the dashboard to further help communicate to families. So I think that would be something interesting to explore. We just haven't done that yet.
Great, thank you. Lots of questions coming in here. So Haley's asking, what surprised you the most about your qualitative findings? Was there anything unexpected that led or will lead to some design iterations for the dashboard, taking things in a direction that you may not have anticipated?
I can start and then I'll ask Jeneesha and Julia to add in. So when we started it, like we wanted to do a quick and estimate, and then we were thinking that, okay, parents would all say in one way, and then we would be able to take that and then incorporate as design features. Just for example, in NICU, when we talk about severity of illness, right? So some of us use a term, okay, it's stable, watcher, unstable, critical. So just example. Or some of them would say on a scale of 1 to 10, 10 being the severe acuity of illness, your infant is currently at 8. Or some others may say on a scale of 1 to 3, mild, moderate, and severe, your baby is at severe end of illness. So we basically wanted to know which terminology parents wanted. But actually, it was very surprising for me to know, like, parents do not want any of those kind of simplified 1, 2, 3 or general terms. They actually, as soon as you use any word, they would like to know more details, what exact problem it is, what are its implications for next day or next 3 days, what are you going to do about it? And almost all parents probably said that they want more information rather than less information. This is kind of like was surprising for me because I was not involved in all the interview process. And then the results started coming in. That's when it was really surprising for me. But there were more surprises for Jeneesha and Julia because they were doing all the analysis and reading through the transcripts.
I think for myself, rather than surprising Haley, I would say what I found most interesting or valuable was that I think that our research, especially our interviews, went beyond just dashboard design. So originally we created these interviews to kind of think about what families would want in these digital dashboards, and we were very zeroed in on that. But what we found throughout the interviews was that there was this broader need for like improved communication within the NICU in general. So I think although we have these themes that can inform the design of the dashboard, it can also create a more like an environment within the NICU where communication itself is more accessible. So it was more about what parents needed within the NICU environment itself. And so that goes beyond just the dashboard and just the environment as a whole. And I think that was really valuable and very interesting. It wasn't something that I was expecting to see. So yeah, that would be what I would have to say. And Julia, if you have anything to add.
Yeah, so I agree with everything that was said. Something for me coming in on the project maybe a little bit later than the other two was that it was interesting to see how parents were envisioning the dashboard as less of like a one-way means of communication, so clinician entering information for parent to see, but how they were envisioning it as a two-way like communication device almost. So of course you have the clinician putting in information about the infant that the parent can see, but also the parent inputting information on for coping, what their understanding of the healthcare of their infant is like, but also what they still needed for their clarification on whether or not they're ready to receive that clarification and more information. So that was just really interesting to see how parents were also thinking of more ways to use the dashboard, so communicating back and forth kind of. And I think also an interesting concept for me um, was the idea that parents didn't really feel reassured just knowing that their infant was getting better, but also if the infant was getting worse, what is the healthcare team doing to help their infant? So it was less the idea that, oh, the only way I can feel better and more reassured is if my infant is doing better, but also that as long as I know the healthcare team is doing something, that in and of itself is a form of reassurance too. So that was just an interesting concept to read about as well in the transcripts.
That's great. Thank you all. Those were awesome reflections. Carola, I see you have your hand up. Go ahead.
Hi, can you hear me? All right. Thanks for a great presentation, Sandesh, Julia, and Jeneesha. It's wonderful to see all the, the results and the work coming together. I'm kind of switching gears a little bit, and I have a question about whether you could speak more to the process of recruitment and engaging with the patient advisor, especially having, families who are alumni and how they were approached, and was recruitment difficult? Yeah, just kind of curious about that whole process. And also, have you shared results with the families that have participated? Yeah.
Jeneesha, maybe would you like to start, and then I'll request Tom to add in because he may know he can provide more details.
Yes, so we had enlisted Tom's help to reach out to alumni NICU families. Tom does have a listserv of emails of alumni families. So we created just like a little infographic inviting families to participate and that they are eligible. We also had some posters in the NICU wards as well as the Ronald McDonald House here on campus. And so although we did have some families reach out from the NICU wards and from Ronald McDonald's house, unfortunately, they were unable to join us just because of how busy they were, understandably. But when it came to the families that Tom had reached out to, they were very excited for this opportunity and very interested. And I'll hand it over to Tom.
Yeah, there was a lot of engagement with this. I think more people responded than you were able to actually interview, wasn't it? So, and it was alumni that had been here within the last 3 years, if I recall correctly, when we did this. So it was all fairly recent NICU experience, and I was interested to hear just how much off of the dashboards the conversations seem to go. So it shows parents don't look at things as being, distinctly stratified into different experiences. It's all one journey. So really interesting work.
Carola, in terms of your second question, I think, Jeneesha, we did ask families would they like to see the results, and those who have indicated the plan is to share the results, right?
Yes, that's correct.
Okay, thank you.
That's great. So I have a question here from Miriam. Again, she thanks you for a great presentation. She asks, apart from vital signs, were there any other clinical components that parents were specifically interested in being communicated about in the dashboard? I think you touched on a little bit of this, but maybe if you could dig into that a little bit. And she's also curious about like what's next for the future of the dashboard. Where do you see it leading?
I would say families were also interested in different ways that they could engage in their infant's care. So whether that would be indicators on the dashboard of when they can start helping with feeds, diaper changes, skin to skin. The NICU also offers events for other NICU families to get together. They have like lunches and Zoom calls. So having the dashboard indicate when those are available for families as well. Another interesting thing was that different families mentioned different features based on what it was that their baby was in the NICU for. So for example, if one baby was struggling to gain weight, one family was heavily emphasizing the feature to track weight gain or just like their baby's weight in general. Another family, their baby, they had to measure the head circumference all the time. And so that was something that they were very on track of. So that was something that they had mentioned. So it was very personal in terms of what exactly the families wanted based off of what their baby was in there for. So I think in that case, also having the option to personalize what kinds of health components are available on the dashboard would be very important as well.
Okay. Just to add on to the second component about the next step and where the dashboard is leading to. So again, this is the first step, right? Like asking parents' preference. We got a lot of surprises, and certainly whatever design you do on the dashboard, families did not want to just stop there. It is just probably a trigger which empowers them to ask the right questions or get more information and have more interaction. That's how they are seeing it. So this information needs to be validated probably in another center or a couple of other centers. Then it would really bring parents-led designing to forefront. That's what we are hoping for. Okay. That said, we were working with a partner called Child Health Imprints. So certainly the technology companies are very interested in turning this into as quickly as possible. So they envision maybe the learnings what we have, rather than relying on a bedside monitor for parents, maybe it should be available on their cell phones or iPads, so that then you're not confined to just displaying the vital signs or diaper changes or etc. I mean, some of this, so then it can be very fluid and you can add on more parameters as they want. And if parents want to enter something, they can also enter, and then there can be a combined kind of parent-led EMR, which can stay on their own, or if necessary, it can be pushed somewhere else. So these are some of the thoughts we have. But anyway, we wanted to finalize the results before we go to the next step.
Fascinating. Wow. Anybody else have any other questions? If you want, you can unmute yourself and ask, or pop in the chat, and I'm happy to read it out.
So while we are waiting for more questions or comments to come by, this study wouldn't have been possible without Julia Santaperella's help, just because she was there as a qualitative researcher and assuring us, yes, we can do this. I think we came along. Without her help, I don't think we would have not dared to do any of these studies. A big shout out and thank you for her.
Yes, thank you for validating the amazingness that is Julia and our qualitative support. For anybody who's looking to do qualitative research and wants to connect and discuss, please reach out to Julia. She's awesome. Well, if there's not any other questions, we had like a really amazing question and answer period there. That was awesome. I'd like to thank today's three speakers, Sandesh, Jeneesha, and Julia, for a wonderful presentation. It's so great to hear about the outcomes of this research that we've been hearing about for so long. So just wonderful. Just thank you for coming and sharing. And I just want everybody to make sure they have a great day and a nice weekend. Thanks, everybody.